Let's talk about the respiratory system and airflow. Let's go through how do we conduct air all the way down into our lungs and finally get to the point where we get to our bronchioles and our alveoli that we call the respiratory zones, or we're going to respire. So let's go through the general flow structurally as I breathe in, and how does it get all the way down into my lungs. And a lot of this we're using just what we call pressure and bulk flow. That's bulk flow, that I brought it in. And as I do that, I can feel the pressure building up internally, and then it wants to let out and equalize. So I'm letting this out. In order to get to that point, though, we have to get the air ready. We have to clean it. We got to warm it, and we got to humidify, add moisture to it. When we add these things, when we clean it, that makes sense. We got to make sure the air is as clean as possible. But when we warm things, it allows for more movement, and we build a lot of the way we process things with water. We know our body is primarily made up of water, so we're going to use humidity to create that moisture to allow the passage of the gases, oxygen, carbon dioxide. So let's describe. As I breathe in, I can obviously breathe in through my nose or my mouth. Some people, when they say they're running, can do both. Some people have different advantages of doing either. But when we're breathing, the best way is to go through my nose because it has more physical protection, but it also gives me that time to clean it and humidify it. So as I breathe into my nose and get into the nasal cavity, what we start to see are what we've learned in previous units is the ethmoid bone, and we look at 1, 2, and 3. These are my nasal conchae. And the first two is my superior, and then my middle nasal conchae. That's part of my ethmoid bone. And then I have my own separate bone, the inferior nasal conchae. As I breathe in, we're creating turbulence, and that turbulence creates like a wind tunnel. And what that's doing is creating the process of already cleaning it and then warming it and then adding moisture to it. We know there's moisture because I develop boogers inside my nose. How do I develop boogers? In a previous video, we talked about respiratory epithelium that has mucus. So we see that PSCC, pseudo stratified ciliated columnar epithelium within my nasal cavity, along with some stratified squamous for protection. But I can use that to create that moisture, and that mucus is also going to trap some of the stuff I breathe in. And you notice when I made that sound, I'm creating the turbulence within the nasal conchae. And again, this is a sagittal cut, so we're not seeing that view, but it's going to cycle through. And I can hear it when I snore. I force the air. And it's creating that sound because it's not just a clear path. It's going to cycle in between these structures that we call a meatus or meati, in between our nasal conchae. So we create that process of already that turbulence to start to clean it, warm it, humidify it. But then you also, when we have remnants of what we've cleaned, that's where you get the boogers, and that's from the mucus. So as I run through the nasal cavity, then we get down into the pharynx, which is the throat, but I can divide it into 3 sections: naso, oral, and laryngopharynx. So naso is referring that I'm coming from the nasal cavity, and this is still lined with our respiratory epithelium, pseudo-stratified ciliated columnar epithelium. And as I drop down, then I start to hit where I combine with the digestive system. The oral, like oral pharynx. So I'm describing that portion of the pipe. Remember, as we've discussed other topics, same pipe or same tube, we just give it a new name as we change different areas because structurally it can change. The oral pharynx in this case is stratified squamous epithelium. When I say it's stratified squamous, the lining of it. So stratified squamous, multiple layers, squamous, and then we're using that for protection. And I need that protection, so when I eat potato chips, it doesn't scratch up my throat. So we go from more PSCC, the pseudo-stratified, to then stratified squamous. And then I also have, remember, a hard palate, the roof of my mouth, and then the soft palate. So when I eat, this will rise up a little bit so the food doesn't go up into my nose. And we've experienced this when we sneeze. So if I'm eating like potato chips and I sneeze, and you get that feeling of the food coming up into your nasal cavity. So nasopharynx, oropharynx, and then laryngopharynx is also shared with the digestive system, which is lined with stratified squamous epithelium. So we're conducting the air as we come down, either through the nose or the mouth. Once we come down, that air's got to either go down the esophagus or down the trachea. But it's going to go down through my larynx, my voice box, and we'll cover all the structures in a different video, and then get down into the trachea. Remember, we have this tissue here, the epiglottis, which is a piece of cartilage, elastic cartilage that moves when I swallow. So it's always open to allow air, but when I swallow when I'm eating, it allows the food to drop down on the posterior side through my esophagus. So we will cover the epiglottis in a different video, and then all the structural pieces of the larynx, which is primarily hyaline cartilage. The bigger and longer these are, the deeper my voice is. But you notice I can change it, and we'll talk about that when we cover the larynx. But our goal is to finally then cross over and get down to the larynx and then pass through the trachea, which we call our windpipe. So we get through the trachea. This is still lined then with our respiratory epithelium, our PSCC, so I can spit up and swallow from whatever I trap with our mucus. And I come down to the trachea, and then as I expand on that, I went through the trachea, same pipe until it splits. We give it a new name. And now we split into our bronchi, which is plural, or bronchus. So it turns into what we call it primary bronchi. And where it does that, we call a piece here called the carina, is where it splits. But primary bronchi. And then it's going to drop down and continue to get smaller and smaller because we're trying to conduct it to the respiratory zone. And the respiratory zone is primarily when we get to our respiratory bronchioles and our alveoli. So I'm showing this expanding out like it's this giant pieces, but we're getting into millimeters at most once we get to the alveoli. As I drop down just to the primary bronchi, it'll then split and become a new name into the secondary bronchi, which we call the lobar bronchi. And then continue on and split again and become tertiary, which we call segmental bronchi. It just keeps smaller and smaller in preparation for respiration. And where that is occurring is in the lungs. I've just taken out the lungs. And we start out about 15 millimeters in diameter. This gradually go to 10, down to about 3 to 5. Once we hit to our bronchioles, we have two types of bronchioles. We have our terminal bronchioles and respiratory bronchioles, referring to just getting smaller and smaller. And now we're less than like a half a millimeter. So it gets, depending on you and your own body, but it gets smaller and smaller and smaller because our goal is to be able to exchange the gases at a molecular level. Once we get into the bronchioles, hit the respiratory bronchioles, we're finally reaching the alveoli. We roughly have 150 million of these little sacs that we'll talk about the respiratory side of it in another video in the exchange. But when we look at these structures, these are meant to be just little sacs to exchange oxygen and carbon dioxide. Our lungs are not a balloon in essence, because a balloon is hollow as they fill it up, but our lungs are full of all of these little sacs, and roughly, again, 150 million of these per lung. And this is the final exchange of gas to where we're delivering oxygen to the blood supply, exchanging the carbon dioxide, and we go right back out. And so we go back to our bronchioles: respiratory, terminal, tertiary bronchi, secondary bronchi, primary, outer trachea, through our larynx, and then we're finally getting back up to our pharynx. So I can respire, relax, now that I've learned the conduction zone and the respiratory zone.